Hello everyone, it's Sophie here again with another video for you. If you haven't seen any of these videos before, I am the hygienist and therapist at North Street Dental in Dudley, and today's video, as you can see from the title, is all about how to look after children's teeth. In dentistry, we split children's age groups up into 3 separate groups, and there's little bits of different advice for each age group. So I'm going to talk about 0 to 3-year-olds, 3 to 6-year-olds, and then 7+. And there's little bits of differences between each of those groups, and hopefully you'll get some tips and advice on how to be looking after your children's teeth. So the first thing to note about children's teeth is that the enamel layer on the outside of the tooth is much thinner than an adult's tooth. Now, the enamel layer helps protect the inside of the tooth. The inside of the tooth contains the nerve, and when that nerve gets touched or contacted, it causes pain. So if we keep that enamel layer strong, it helps protect the inner part of the tooth and protect against toothache. And that's the same with adult teeth, but because the layer is much thinner in children's teeth, the decay process happens much more quickly, and so we must keep the enamel strong as much as we can in children's teeth to help protect the need, to help prevent the need for any treatment of their teeth. So by keeping them clean and keeping the teeth sugar free as you're keeping them brushed, you're helping protect against the need for any treatment for them. So the first age group that we have is the 0 to 3-year-olds, so the babies and the toddlers, and this is the age group when their teeth start to come through into the gum, or the fancy name is to erupt, and you can see that when the white bumps start to show as they're coming through the gum, and that's normally between 6 to 12 months, and parents often know about it because the child can be quite grizzly, and what we want to be doing is, as soon as those teeth are showing in the mouth, is to brush them. And you can use baby brushes, which are really soft. You can also use brushes that just fit onto your finger, so you can just rub them around the mouth. Some people will do this before their child gets their first teeth through, and that just gets them used to the texture of the bristles on the gums. You don't need to scrub them, just nice and gently, just getting them used to that texture. But as soon as those teeth come through, they should be being brushed. If the child is reluctant to let you look in their mouth because their mouth is painful, then using fluoride toothpaste, just a smear with the finger, can just be sufficient enough. When you're brushing your child's teeth at this age, so the 0 to 3 group, you should be using a toothpaste that contains 1,000 parts per million, and you can see that by looking at the packaging on the back of your toothpaste tube. And for this age group, for the whole of the age group, you just need to use a smear on the bristles. I'm just going to show you what a smear looks like. It's just a little touch on the end of the bristles, and that's enough fluoride to keep the teeth nice and healthy. Fluoride is a naturally occurring mineral that helps strengthen the outer layer, so that enamel of the teeth. So even if you can't get the toothbrush in, if there's certain phases where they're being fussy and they won't let you in, just use a bit of fluoride and that could be sufficient enough. But whenever possible, try to use a brush. Keep the experience as positive as much as you can. I know it's difficult when they're in pain or if they're particularly grizzly, but keeping the experience positive is important. So using songs that they're familiar with, characters that they're used to, also seeing other members of the family brushing their teeth too, so another parent or yourself in the mirror or another sibling, but also following YouTube videos that they like. So there's lots of different characters that have made stories about brushing teeth, so Peppa Pig and Hey Duggee and all those kind of characters. There's lots of different things out there, also storybooks and all that kind of thing, so keeping it positive. Also, this group should be visiting the dentist as soon as their teeth come through, so again, that keeps them positive in the fact that they're getting used to seeing the dentist, they're getting used to the sights, the smells and the textures. The earlier that you can do that, the more likely they are to be positive towards visiting the dentist in the future. We find that children that don't see the dentist and only see the dentist when there's a problem, that's when they start to get dental fear or dentophobia, because they associate it with a negative experience. Whereas if you're with them when they're tiny, getting them used to the textures and the smells can really impact them in a positive way as they get older. So this group, brushing twice a day with 1,000 parts per million fluoride, and that's sufficient enough to keep their teeth clean. So the second age group is the 3 to 6-year-olds. So The routine that these children use is the same as what we've already talked about. So brushing twice a day still, and using the same toothpaste. So still using the 1,000 parts per million, but using a little bit more toothpaste than we were before. So now you want to use a pea-sized amount rather than a smear. So it looks about this amount. So a little bit more, and that's because they've now got more teeth in their mouth, so they need a little bit more fluoride to be getting over all the teeth. These children can then start to be brushing their teeth a little bit more independently, but still not completely on their own. Still want to be supervising the children and doing the majority of the brushing for them if you can, but giving them ownership of their own brushing is often a really positive way to get them to look after the teeth themselves. Another thing that we would encourage children to start doing at this age is to spit out the toothpaste but don't rinse it away. We often say spit, don't rinse, and that's because if you rinse after brushing, you rinse away all the goodness of the toothpaste, so it almost becomes pointless in using it. So spitting it away but not rinsing it away is another good tip. This age group are often quite responsive to reward systems too, so starting to use sticker charts if you haven't already used them, reward systems, but also things available on gadgets and smartphones and apps. There are a lot of toothbrushing apps that you can get hold of that you can follow their brushing, and they can get games and rewards and points and things when they follow those systems. And also still keeping positive around the talk of the dentist, still going to see the dentist regularly, and keeping everything positive around their teeth and the care of their teeth, because then that will then give them positive habits for the future. So this group, brushing twice a day, still using the fluoride toothpaste, but now using a little bit more. So the last group is the 7 years and over. This group is the group that now has what we call a mixed dentition. So this means that they have a mixture of adult teeth and baby teeth in their mouth at the same time. And that's because the baby teeth start to get wobbly, they come out, the tooth fairy comes, does the deal, and then the adult tooth moves into its place. And that adult tooth now has to last that child a lifetime. There's no more second chances. That adult tooth is the only one it's got left. So making sure that your child is really aware of their health of their mouth is really important at this stage. Normally at around 7, the child is at an age where they can capably brush their teeth themselves, but you may want to start introducing things like electric brushes. There's ones out there on the market that are specifically targeted to that age group, and it can be a good way to get them into good habits. And we do encourage electric toothbrushes for adults, and they can be great for children as well, because they're less technique sensitive. The child just has to hold the brush on the tooth and move it round. I've got a whole video about electric toothbrushes, so if you look further on the page you'll see my video on brushing, and those techniques are suitable for children and adults, so take a look at that if you need some advice with that. But it might be a good idea to get them using an electric toothbrush now. And they can now use a toothpaste with more fluoride in too. We normally recommend 1,350 parts per million of fluoride, and typically most toothpaste brands are really good at labelling who their toothpaste is for. They will say the age on the front of the packaging, but if you're not sure, always just read on the back, and a child of 7 should be using 1,350 parts per million of fluoride in their toothpaste, and they should be brushing twice a day as they have been before. But now you might want to take a step back and let the child do their own brushing. For now you might want to just check up on them, make sure that they're doing the right amount of time. One thing that I haven't mentioned yet is how long they should be brushing for. Providing you can keep their attention for a good amount of time, 2 minutes is always a good time to recommend. One thing that I recommend using are these timers. You can get these online for pretty much pence. They're really cheap, but these last for 2 minutes. Make sure it's a 2-minute one. You just pop it on the sink, turn it over when your child starts, and it's a good way to keep the child motivated with their brushing. Even adults too, these can be quite good, because actually 2 minutes is a lot longer than you think. But you can also get timers online. There's a lot of videos that have characters for 2 minutes that will encourage your child to brush along. So making sure that they're getting the good habits in, spit, don't rinse, 2 minutes of brushing, and by this age they should be doing twice a day and using a good fluoride toothpaste. So as you can tell, children should have pretty much the same routine throughout their lives, brushing twice a day, morning and evening, and using a fluoride toothpaste. They should also be seeing the dentist on a regular basis, at least yearly. Some dentists may want to see them more regularly than that, but we have found that people that start with a good dental routine as children will often carry it into adulthood. So if you can get your child with a good healthy mouth now, there is a high chance that they will have a healthy mouth throughout the rest of their lives. So hopefully you have found this video useful. If you haven't had your child checked by a dentist, get them booked in, and hopefully we will see you soon.